Hey everyone, and welcome to this explainer. Today we're unpacking one of the absolutely most ambitious scientific challenges humanity has ever undertaken, directly connecting the human brain with computers. We're talking about taking something that has been the exclusive domain of science fiction for decades, like the digital worlds of The Matrix or Cyberpunk, and bringing it right into modern clinical reality. It's this fascinating, mind-bending blend of neuroscience, artificial intelligence, and cutting-edge engineering, and we are going to break it all down step by step.
So, I want you to really think about this ultimate question on the screen right now. Could computers someday understand what you're thinking? For literally thousands of years, your thoughts, your memories, your intentions, they've all remained securely locked inside the biological vault of your skull. Up until now, if you wanted to interact with the world, you had to use your muscles, right? To speak, to type on a keyboard, to gesture. But what if that physical barrier was just removed entirely?
Well, guess what? The answer to that mind-reading question isn't some distant pipe dream. It's already beginning to unfold in modern laboratories right now. We're actively building a bridge between biology and technology. Scientists aren't just looking at static pictures of the brain anymore. They're literally tapping into the brain's circuitry to translate raw, real-time thoughts directly into digital information.
Okay, let's dive into this. Here's our roadmap for exploring this massive technological frontier. We'll start with the biology of thought, check out the engineering bridging the gap, look at some real-world medical breakthroughs, explore the industry race, weigh the risks, and finally look at the future of human interaction.
Starting with Section 1, The Mind Unlocked, the Biology of Thought.
To truly get how a brain-computer interface works, we first have to ground this whole concept in actual human biology. We need to understand the language the brain speaks. So look at the biological hardware in front of you. The neuron is the fundamental unit of your nervous system. You've got billions of these specialized cells, and they communicate with each other across tiny gaps called synapses. But the critical loophole that engineers are exploiting here is exactly how they communicate. It's through electrical signals. Literally every thought you have, every memory you recall, and every single movement you intend to make is at its core a massive storm of tiny electrical impulses.
Let's track how this actually builds into an action. When you want to, say, move your hand, an intention forms. Instantly, neurons fire what are called action potentials. These are literal electrical spikes. These signals travel super fast to specific regions, like the motor cortex, which is the part that controls voluntary movement, and finally, the intended movement happens. I really want you to remember this chain reaction. Scientists realized, hey, if we can intercept those electrical signals right at step 3, right at the motor cortex, acting essentially like a wiretap on your nervous system, we don't even need step 4 to happen biologically. We don't need the physical arm at all. We can just use a computer to execute the movement instead.
Which brings us to Section 2, Translating Thoughts to Data, the Engineering Bridge.
Now, reading thoughts, not quite as simple as it sounds. We know how thoughts work biologically, sure, but capturing those microscopic electrical spikes through the thick, dense bone of the human skull requires some truly incredible engineering. We generally see two main hardware approaches today. On one side, we have non-invasive BCIs. Think EEG sensors placed over the scalp. These are awesome because they're totally safe and require zero surgery. But the skull is an incredible insulator, so the signals they pick up are pretty muffled. It's kind of like trying to listen to a symphony from out in the parking lot of the concert hall. You'll hear the booming bass, sure, but you lose all those delicate notes from the violins. On the flip side, we have invasive BCIs. These are implants surgically placed directly on or inside the brain tissue itself. Obviously, requiring brain surgery is a major hurdle, but they offer incredibly high-resolution data because they're listening to the neurons right at the source. They are sitting in the front row of that concert.
But here's the catch. The hardware only collects the data. If you were to just look at the raw electrical signals coming out of the brain, it would look like absolute chaos, just pure static. And that is exactly where artificial intelligence steps in. AI neural decoding is absolutely the secret sauce of modern brain-computer interfaces. The AI acts as a digital Rosetta Stone. It's analyzing millions of chaotic data points per second to figure out that this specific pattern of electrical noise means move cursor left, or that pattern means type the letter A. Researchers are using advanced machine learning to find the hidden patterns in that electrical noise, instantly converting it into clear, executable digital commands.
Moving on to Section 3, Real-World Medical Breakthroughs, Human Impact.
Let's talk about the human impact, because this is where it gets incredibly real. It's vital to understand that this isn't just a fun computer science theory anymore. This tech is actively changing lives today. To understand the urgency, just look at this staggering number. According to data from the World Health Organization, hundreds of millions of people globally suffer from severe neurological disorders. We're talking about conditions that completely sever the connection between the brain and the body, essentially trapping active, brilliant minds inside bodies that just no longer respond. This immense scale of medical need is exactly why so much capital, brilliant research, and deep dedication are pouring into this field right now.
And the clinical trials happening today, they're nothing short of miraculous. We're seeing paralysis treatments where patients can move robotic prosthetics simply by thinking about it. Imagine the profound dignity of a patient with ALS who hasn't been able to speak in years, finally being able to tell their family they love them, literally just by thinking the words. BCIs are restoring communication through speech synthesis, instantly translating their intended words directly onto a screen. We're also seeing massive advancements in stroke rehabilitation and cursor control, giving paralyzed patients their independence back. They can browse the web, send emails, control their smart home environment, all entirely through thought.
Which leads us into Section 4, the tech companies competing, the industry race.
These clinical breakthroughs changed neuroscience forever, and honestly, they sparked a massive corporate race. While academic labs laid all the early groundwork, private industry is now pushing the envelope at totally unprecedented speeds. Looking objectively at the landscape, competing private companies are pursuing radically different engineering solutions. You have Neuralink developing these ultra-thin thread implants inserted by a surgical robot, threads actually thinner than a human hair. Then there's Synchron taking a completely different route. They insert a stent shroud up through the blood vessels in the neck, brilliantly avoiding open brain surgery entirely. Precision Neuroscience is working on ultra-thin, flexible surface arrays that just sit gently on top of the brain. And BlackRock Neurotech has been a pioneer for years with their Utah array, which kind of looks like a microscopic bed of nails. Each of these has unique benefits and, of course, unique engineering hurdles to overcome.
Because of these differing approaches and the massive potential at play, the financial data is just staggering. Looking at the capital breakdown in this donut chart, you can clearly see the massive influx of investments across AI healthcare, clinical trials, and medical device growth. And notice how AI healthcare takes up such a huge slice of that pie? That's because, as we discussed earlier, decoding the brain is largely a software bottleneck right now. Investors and medical institutions completely recognize that whoever perfects this AI bridge between biology and technology is going to fundamentally transform healthcare as we know it. Let's move to Section 5, Risks, Ethics, and Security, the challenges ahead. Okay, let's hit the brakes for a second, because reading thoughts isn't all sunshine and rainbows. Surprisingly, the biggest challenge moving forward might not even be the hardware. We have to impartially weigh this out. On one hand, we're looking at literal medical miracles, restoring movement, synthesizing speech, giving people their autonomy back. But on the other, we're opening the door to unprecedented technological threats. We're talking about dialogical data privacy. What happens if a brain-computer interface gets hacked? Imagine a scenario where a malicious hacker doesn't just steal your email password, but actually intercepts the raw data right from your motor cortex. The cybersecurity implications of a device connected directly to your brain are profound. It forces us to ask entirely new questions about cognitive privacy that humanity has literally never had to answer before.
And beyond those digital risks, there are massive physical and societal roadblocks too. As you can see listed here, the human body really does not like foreign objects. Your brain's immune system naturally attacks anything that isn't supposed to be there, creating glial scar tissue around implants. The scarring can eventually block those delicate electrical signals, degrading the device's quality over time. Then there are the inherent surgical risks. Companies have to prove long-term implant reliability to stringent agencies like the FDA. And crucially, this is a big one, there's the question of accessibility. Will this life-changing technology actually be available to everyone who needs it, or just a wealthy few? These are serious hurdles the industry has to solve before BCIs go mainstream.
Finally, Section 6, the future of interaction beyond the horizon. This brings us to such a fascinating frontier. What happens when we look beyond the horizon, moving past purely medical treatments and into the realm of actually enhancing human capabilities? Let's trace this evolution on the timeline. In the present, as we've seen, the focus is strictly on medical restoration and basic cursor control. But in the near future, experts predict we'll achieve flawless, high-speed thought-to-text, where you could literally write a novel just by thinking it. But further down the line, we enter the speculative future. Augmented cognition, memory assistance, and seamless integration with mixed reality environments. We're talking about a time when your thoughts could seamlessly interact with augmented reality. No keyboards, no mice, no screens. Just pure intention interfacing directly with the digital world.
I absolutely love this quote from the source material, and I want to read it for you. The greatest technological revolutions don't always begin with machines. Sometimes they begin inside the human mind. I think that just perfectly captures the profound nature of what we are attempting to do here. We aren't just building a cool new gadget, we are unlocking the biological vault to expand what humans are fundamentally capable of doing.
Which leaves us with one final, incredibly provocative question to ponder. Will brain-computer interfaces become our greatest medical achievement or our most dangerous ethical dilemma? The technology is already here, guys, and the future is arriving faster than ever. How it impacts humanity is going to depend entirely on how responsibly we choose to build it. Thank you so much for joining me on this explainer, and remember to always keep questioning the incredible world of science around you.
Thanks for watching World Decoded. Make sure to like and share, subscribe, and stay curious.